Antianginal drugs. So we are going to learn about anti-anginal drugs. So you can observe in the figure what we have shown. You see there is a chest pain here. So you'll be doing your normal activity. What happens? You feel chest pain. I told many times what's the difference between congestive heart failure and angina pectoris. Congestive heart failure, what happens is that when you walk, you get difficulty in breathing. But here, when you walk, you get pain on the chest and radiating to the left hand, neck. Those are the symptoms for angina. So, anti-anginal drugs are used in angina pectoris. Anti-anginal drugs are used in treatment of angina pectoris. Here, what is the main reason is that there is decreased blood supply to heart itself. In CHF, the blood supply to distant organs is decreased, whereas in angina pectoris, decreased blood supply to heart. That's why it's also called as ischemia. So coronary artery is the one. So heart is also one organ. Heart is also one organ. So it also need blood supply. It also need the blood supply. The blood supply to the heart. Inside heart, it will be present. The blood supply to heart muscle is supplied by coronary artery. So there is some problem in the coronary artery. So this is also called as coronary artery diseases. It can also be called as coronary artery. One of the coronary artery diseases, there will be problem, blockade, fat deposition, a clot deposition will be present here. So in nutshell, what is anti-anginal drugs? Drugs used in treatment of angina pectoris. So what is the main symptom here? Chest pain. The chest pain, you can see it here, the patient, while climbing, they may get the symptoms. So they get chest pain, very severe chest pain, not simple chest pain. And don't think whenever you get some chest pain, it may be angina pectoris. The pain is so intense that you feel some heavy object or a big stone is present on your chest. That is the symptom. That is the symptom. Normal chest pain, it is not that. Here it will be like a squeezing. We will discuss it. Very heavy it will be. So this is the in details. Let us see. So what is angina pectoris? You can see it. Some of the things simply I told you in previous slide. Now you can see angina pectoris is commonly called as angina. It's also commonly called as angina, which means chest pain or discomfort in the chest. There is discomfort in the chest. The pain is so intense, I was telling you. What's the main reason? There is a decreased blood supply. Oxygenated blood supply to the heart is not sufficient. In congestive heart failure, the blood supply to distant organs is decreased. Here, blood supply to heart muscle is decreased. And why it happens is there is decreased, there is imbalance between the supply and demand. So for example, you're running. The heart needs efficiently to pump. That is the, while running, you need demand. But the supply, the coronary artery should be efficiently good vasodilation. Then only blood can go on, can reach the myocardium. So there is imbalance between oxygen supply and demand. That means when you are climbing, for example, you are climbing a staircase. It's a staircase. If you are climbing, the demand during that time is high. So oxygenated blood also should be supplied. So there is imbalance. So this happens. Because of this imbalance, you feel squeezed, high chest pain here. So here, see, there is a transient of 15 seconds. 15 seconds to 15 minutes. It all depends person to person. Within 15 to 15 minutes, the range window we are telling, within that window, the blood supply has to regained to the heart. To the heart. Ischemia means, ischemia means what? Decreased blood supply. So if this is not happening, it will become myocardial infarction. It will become myocardial infarction, that is cellular death, and myocardial infarction occurs. Within 15 minutes or within 15 seconds to 15 minutes, person to person. That's a range which they have given. So within that, the blood supply has to be regained. Regained. Then the patient is stable, will be stable. So this is the thing. Now in next slide, we will see what are different types of here. Some more we will see it. See, this is the angina may be due to spasm. So here, this is the coronary artery. See, this is a left coronary artery. This is aorta. From aorta, blood supply is given to the blood to the heart. This is left coronary artery. Then from the left coronary artery, it becomes to different branches. You can see it. There is a different branches where it is circulating. So left coronary artery and right coronary artery. This coronary artery will supply blood, oxygenated blood to the right atrium. Left coronary artery. Usually what happens, there is some blockade somewhere in this fine micro capillaries of coronary artery. So this is further, if you want the names, left circumflex artery, left marginal artery. So what happens is that they're becoming small. You see, left anterior descending. So it is going down. Left anterior descending artery. So then diagonal branch. So these are the terms we can find them when you done some what's that, angiogram. So with the help of angiogram, you can find the blocks. For example, here the red blocks, see somewhere here. So what happens if there is a block here? It may be due to spasm. It may be due to spasm or atherosclerosis or a clot. What happens? The blood supply to this spot is decreased. The same way here. Now you see there is a blood clot here. What happens? This spot is blood supply is decreased. Suppose if this big one is, there is a clot. For example, if there is a big clot in the big, what is that, left descending artery, what happens? Entire part of the muscle, blood supply decreases. It goes to myocardial infarction. You feel the chest pain and all this. So what happens is that there may be fat deposition. You can see it here. So when there is fat deposition, blood supply, what happens? Decreases. Here also you can see the figure here from upper but the bottom, the fat is deposited. What happened? Blood supply is already these capillaries are very fine in nature. Fine in nature. So if there is blockade here because of this atherosclerosis or spasm, you can see it here, spasm here. For some people, the blood vessel is constricted always because of type 1 personality. We can see it. The one who is very angry every time, adrenaline is released. So, or for some people, it may be genetic, it may be spasm. So because of this, what happened? Angina pectoris is due to spasm or obstruction or atherosclerosis. So what happens is that there is decreased blood supply to the part where it is blocked. Suppose if it is here, the blood supply here is stopped. You feel the pain and all this. So patient may feel pressure or squeezing in the heart. It is very, not simple terms. Huh? It will be very, very heavy, as if you are by stage. Hmm? Okay. Patient feels pressure or squeezing in the heart. So the discomfort radiates to the pain radiates to shoulders, arms, neck, jaw, or even the backside of our body. Backside of our body. So what are the treatments? Treatments, you can see it. Percutaneous coronary. Sorry, because it may be due to internet issues. I think now, can you hear me?
Yes.
Ah. So the blood supply is decreased. So now the treatment is that you can use drugs, and you can also use this percutaneous coronary intervention. So what happens is that you pass some, it is called as stunting. So this, when you pass it, now what happens? It will be enlarged. It will be enlarged. So the diameter of the blood vessel is increased. This is called, this in the normal term we call stents. Nowadays they are giving a drug eluting. So you will be having a drug present in this stenting, and it will be eluting, uh, uh, releasing the drug. So that drug can be vasodilator, and also this stenting. Stents will help us to increase the diameter. Now you see, if the stent is passed here, what happens? It becomes the it will increase the size of the diameter like this and like this. Or if it is in the major blood vessels, if it is in the major blood vessel, and if the damage is very high, what happens is that you can use coronary artery bypass grafting. See, from aorta, a new blood vessel from your thigh or somewhere, from your hand, they pick and they connect it. And so while you're traveling, what happens if the bridge is collapsed? What you do? Suppose if this is the bridge, it got collapsed. So you try to move from another direction. So government will make a small way to move from another direction for temporary. In the same way, here we do it. There is a blood vessel taken and is applied onto the, is connected to another blood. So for example, here to here, if it is, there is a blockade here. This is called as coronary artery bypass grafting, cabbage. The short term, it is called as cabbage. So one is the technique is that coronary intervention, coronary percutaneous coronary intervention, that is PCI. One more is, you if the this the same concept, if there is a drug eluting, then it is called as drug eluting stents. Drug eluting stents. So this is the nutshell, detailed information about the coronary artery diseases, that is angina pectoris. So these are the some of the aggregating factors which present here. You can see it: hypertension, diabetes, age factor, obesity, smoking, stress, age. So generally this after 50 years or 40, nowadays for everyone it is coming. but general olden days it was for age after 50 years maximum. Then aging, diabetes, atherosclerosis, the fat deposit. Atherosclerosis, it means fat deposition. Huh? One more is a coronary microvascular dysfunction. If the micro blood vessels are these blood vessels, if there is any dysfunction, uh, what happens? You also get that. So this may be due to hypertension, diabetes, impaired vasodilation capacity, endothelium dependent mechanism, inflammations. The age is that. Then vasospasm. You see, female are more able to suffer. Young age also sometimes. Smoking and obesity are the other causes. So these are the facts about this disease. Now we will try to learn about these different types of angina very fast, because there are drugs. The stable angina, there are different types of angina. One is stable, unstable, and Prince-Metal angina. This is unstable. This is one more called as Prince-Metal's angina. So three different types of angina is present. Now, the first one is called as stable angina. It is very most common type 1. That's why we also call it as a typical angina. That's why we also call it as typical angina. See, most common, we also call it as typical angina pectoris. The characteristics, whatever we studied till now, you feel and burning, heaviness in the chest, burning in the chest, squeezing in the chest. Here, what happens is that you get all these symptoms, but when you take rest, what happens is that the pain is relieved. That's why we give the name stable. Clear? You are running. You feel heaviness or pain in the chest. If you take rest, what happens is that the pain is relieved. Then it is called as stable angina. See, you can see some of the causes. See, here it may be due to physical activity. That's what I was telling you. When you're climbing a staircase or running, or emotional excitement. Even if you tell a good one or bad thing, then it is also reason for this angina you will get an. Or if there is any cardiac output, cardiac workload. So what is the main here? You get all these symptoms, whatever we discussed, but when you take rest, when you take rest, what happens? The pain is relieved. Then it is called as stable angina. It's also called, it is very common. That's why we also call it as typical angina. So the main drugs here we give is nitroglycerin tablets. Very beautiful drugs, which when you place under the tongue, immediately you get relief. And within 5 seconds, you get relief. You need to place the drug under the tongue, sublingual route of administration. So this is a then unstable angina. So here, what happens? The episodes of angina will come frequently, even after taking rest. Even after taking rest, the symptoms are not relieved. Then it is called as unstable. Stable angina, what happens? When you take rest, it will keep quiet. In unstable angina, what happens is that even after taking rest, it will not relieve it. It's very dangerous. You need to hospitalize the patient. Lot of drugs will be given in unstable angina. You'll be given nitroglycerin, antiplatelet. We can see all the drugs you need to give, because we don't know when you are going to get on. You are going to get on. So this unstable angina lies between stable angina. It is between stable angina. If not treated, it will become myocardial infarction. The myocardial infraction. it will become myocardial infarction. So it is between that stable angina. If you take this as a stable angina, if you take this as a stable angina, then this is our unstable angina. Then this is myocardial infarction. This will be the first, next this, then this one. For some people, it progresses slowly. For some people, it grows immediately, and death also will occur. Death also will occur. So it all depends upon person to person. Next one, fringe metal angina. So here the name is fringe metals angina is there. There is no any metal associated with it, but they have given the name fringe metal angina, which is also called as aplastic anemia, which is also called as aplastic or variant angina. There is no any metal associated here. Please remember, but it's a variant and vasospastic. That means the muscle, the blood vessel here always in the spasm. It will be here. Sorry. It will be in this position always. For some reason, we don't know the reason. So always the patient will be having spasm in the coronary arteries. So then it is called as fringe metal angina pectoris. It may be due to genetics. So here the treatment is very good is calcium channel blockers. The calcium channel blockers, even for other diseases also we give, but this here there is it's a prominent good drugs are calcium channel blockers, especially nifedipine, diltiazem. We studied all this, I guess. We studied all this. Please remember them. Nifedipine, diltiazem, nitroglycerin tablets also we give. They all help on. So these are the three types of angina. Stable, you'll feel pain. When you take rest, it will be relieved. So the treatment nitroglycerin. Then unstable angina, what happens? Even after taking rest, you feel pain, and the episodes are frequent. Then it is unstable angina. The fringe metal angina is nothing but the spasm. Blood vessel is always constricted. Yes, Priska.
So I don't understand the last type when you say that there is no metal involved. Like I don't understand that part.
Yeah, then you generally by seeing the name, we think some metal is associated with the fringe metal angina. So while I was a student also, I was thinking some metal is responsible for this angina. There is no any metal here. Here what happens, coronary artery, you get pain even in the rest. Here it is due to coronary artery spasm. That's what I was telling. The spasm means the blood vessel is constricted here. You see, like this it will be. So always, for some people, for unknown reason, the coronary artery is in spasm. Then it is called as fringe metal angina. Clear, Priska?
Yes, sir.
That is only difference. There is generally by seeing the name, you think some metal is associated. That's why they have given the name. I don't know why they given the name, but it is that one. So this is now classification of drugs. Classification of drugs. There are many drugs. You can see. Yes, again, Selena.
You said that you do drugs for civil angina and things like that, but I didn't say any for consider. So how do you
Sorry, Selena, we are not able to hear you. There is lot of echo in your from where you are talking. There is lot of echo.
Hello, can you hear me now?
Yes.
Yeah, I was saying that you give drugs for stable angina and the Prince metals, but I didn't really hear any for unstable. So how do you manage unstable angina?
Unstable angina, that's what I was telling. You need to get hospitalized. Unstable angina requires hospital administration. Sometimes even we give morphine drug, very painful. So all this you need to give aggressive therapy. You need to give. Unstable angina requires hospital admission and more aggressive therapy to prevent progression to the myocardial infarction and death. So we give all these drugs, all these drugs we give. That's why we are going one by one. So patient may stay one month, or some people can stay for 1 week or 2 weeks. Once he's stable, even after walking and all those, then they will send him. Clear, please?
Yes, sir.
You can lower your hands. Now, these are the classification of drugs. So the classification of drugs are organic nitrates, then organic nitrites and inorganic nitrates. Both organic and inorganic nitrates and nitrites can be used. So you can see it. Actually, these drugs are discovered from an arms industry. So actually, this nitroglycerin is explosive in nature. So in World War I, II, they were aggressively using. So the people who were working there were complained that they have severe headache. They discovered, then they done some studies and found that that headache is due to vasodilation effect. Vasodilation effect. That concept they have tried and successful in angina pectoris. So by unknown, but suddenly they discovered it was not any study done or anything. So the people who are working in a arms industry, the bomb, atom bomb, not atom bomb, especially nitrates, guns, who are working there, they frequently complained about severe headache by end of the day. When they done the research, they found that it is due to vasodilation effect. So the blood supply to the head is decreased. So that concept, when they done research, they found these are very good for relieving vasodilation effect in coronary blood vessel. So what are the drugs? You see, nitroglycerin, which is very, very good drug. Nitroglycerin, it is a liquid, but we make it into solid drug. So volatile, you can see it is a moderately volatile and rapidly acting drug. So what is the time space I told? 0.5 seconds, 0.5 seconds to 15 minutes between. Within that period, if you give drug, this will act. So within seconds, maybe 1, 2, your blood vessel, your pain will be relieved. Then isosorbate dinitrate, nitrate, isosorbate mononitrate, erythritol tetranitrite, and pentaerythritol tetranitrate. These are all solids. These are all solids. They take time to show action. Let us see. Then organic nitrite, amyl nitrite. One more drug is amyl nitrate, which is highly volatile and rapidly acting. But this is very, very famous drug. Then inorganic nitrates, sodium nitrite and sodium nitroprusside are some of the inorganic drugs. Inorganic drugs. Now, other drugs which are nowadays used are along with these drugs. Along with these drugs, these are taking nowadays importance. That is cytoprotective drugs, trimetazidine, Ranolazine. These two drugs, and potassium channel opener, Nicorandil. They are also nowadays they are prescribing more. We will discuss it. What it does is that it maintains cardiac metabolic, it modulates. When the blood supply is decreased, you get more free radicals, ATP will be decreased. So on that mechanism, these drugs will act on trimetazidine and Ranolazine. Then potassium channel openers, which is also very good drug, Nicorandil. That is also prescribed. Then beta blockers, bisoprolol, atenolol, or metoprolol can be given. The calcium channel blockers, especially the ones which are what's it? Dihydropyridines, dipines, and what is that? Benzodiazepines. That is diltiazem can be used. And you should not use phenylalkyl amines. Phenylalkyl amines will act on the cardiac muscle, not on the blood vessel. I already told you that. Please refer that. These drugs are very good vasodilator. 1 and 2, that is the dihydropyridines, DHPs, dihydropyridines, 1,4-dihydropyridines, and benzodiazepines are very good drugs. Then here AC inhibitor, ramipril is good. Then this antiplatelet drugs. So if this is the blood vessel, if there is clot inside, that also we need to take care. Those are antiplatelet drugs: aspirin, pentoxifylline, dipyridamole, clopidogrel. Then most of the aged parents, they may be using any one combination of these drugs. Then anti-lipid drugs, atorvastatin, very good drug, atorvastatin, you can use it. Then other ways, if it is emergency, complete, if doctor feels he can go for percutaneous coronary intervention or CABG, which I was telling by showing the diagram. That is coronary artery bypass grafting. So these are various drugs. So now let us study about organic nitrates. Any doubt, please? Please do sign for attendance. So organic nitrates, they are vasodilators. So if this is vasodilator, for example, you see the blood supply here. If it is like this, the blood vessels are like this. Blood vessels are like this. Now, if you give these drugs, will increase the flow. I used to tell the vasodilators are like just like this. The thick our USI road converting into thicker road. So blood supply is increased. So when these fine capillaries, if there is a block, what happens? You give drugs which increase the diameter. So blood supply to this part is increased. Every part is increased. That is the way how these drugs act. So these are the some of the drugs. You can see the chemistry part here. Please, nitroglycerin. Nitroglycerin. Here you can see it. Glycerin. Why? Sorry. Glycerin is this structure. Glycerin is this structure. CH2 OH, CH, OH, and CH2OH. This is glycerine. So this is glycerine. Now what happens is that this glycerine or glycerol, you can also call it as glycerine. The glycerine is which you many people in cosmetics they have one. That is the same. It's also called as glycerol. Glycerine and glycerol are the same. Now what happens is that one of its hydrogen is replaced by nitro group. Nitration we do it on. Then it is called as nitro. Nitro means this is nitro group and glycerine. Nitroglycerine. Other ways you can also see glyceryl trinitrate. How many are there? 1, 2, 3. So glyceryl trinitrate. Then amyl alcohol has nitro group. Then it is called as amyl nitrate. Then this is isosorbate dinitrite. Isosorbate dinite, 2 furan molecule, tetrahydrofuran molecules will be present. It's a sugar molecule. Because of water loss of 2 water molecules, it is becoming isosorbate dinitrate. Then one more, its derivative. On prodrug, it is on metabolism. Denitration will also produce 1 nitro group. Then it is called as isosorbate mononitrate. Even this is also active. So these are the nitrate drugs which they are using. Among all these, the fastest acting drug is nitroglycerin tablets. This is the fastest acting drug. All these are used to maintain the disease. They will be slowly released and treat the pain. Slowly they release the drug, long-acting drugs. So on long-acting, what happens? The drug is slowly released and continuously causing vasodilation effect. So for unstable angina, what happens? We don't know when the pain comes. So we need to use drugs which are continuously vasodilators. So this is drugs. Now, this is the mechanism of action. So how it acts, you can see it. When you administer these drugs are nitrates, NO3 is present. Slowly in the body, it is converted to nitrite. See, one of the oxygen is decreased. So it is becoming nitrate. Then finally, it will convert to nitric oxide. Nitric oxide. This is NO, nitric oxide. So nitric oxide is responsible for vasodilation effect. Vasodilation effect. What it does is that, you see, GTP, guanosine triphosphate, just like ATP, GTP is present. GTP converts to cyclic GMP, that is cyclic guanosine monophosphate. This is the active molecule, just like ATP to cyclic AMP. In the same way, the cyclic GMP, what it does is that it dephosphorylates myosin light chain, actin myosin filament, which is of muscles. They are the components of muscle. So resulting in when there is dephosphorylation, it causes vasodilation. Vascular smooth muscles are relaxed. That is nothing but vasodilation. When there is vasodilation, what happens? The blood supply to the heart muscle is increased. So this is all. See, nitrates are converted to nitrite, then nitric oxide. Nitric oxide. Nitric oxide, nowadays there is a lot of research going on nitric oxide. It is also, they're telling now it's an antibacterial AMR, in AMR, what's that, antimicrobial resistance. There also they are trying this one. Yes, please, Ash.
I wanted to ask, so in the case of nitroglycerin, it had a NO2 portion, right?
Yeah.
So basically it will just reduce.
Yeah, totally NO3 if you see it. NO2,
Oh yes, NO3, yes.
totally it is NO3.
So it will just undergo reduction.
The glycerin is like a carrier. Yeah, it can enter into citric acid cycle. The nitrates which are present will be slowly reduced. It's a reduction process. Yes or no, please? So one of the oxygens, it is reducing, losing one of the oxygen. So nitrates will convert to nitrites, nitrates will convert to nitric oxide. Then the active component here is nitric oxide, which converts GTP to cyclic GMP. Now this will dephosphorylate myosin light chain, resulting in vascular smooth muscles relaxation. Smooth muscles here in the heart, blood vessels are relaxed, so blood supply to heart is increased. So you will relieve your pain. So this is done. Any doubt, please? Okay. Now this is how, and one more important thing is that these drugs are having first pass metabolism. 90% of drug, even in calcium channel blockers, we studied, they have a lot of first pass metabolism. In the same way, these nitroglycerin tablets are usually there in the tablets in the sublingual. So when you take oral route, they get denitrated. So one nitrates, it gets denitrated, and finally you will get glycerol. So it is a what is that? Denitration. Sometimes it is causing to get inactivated. In the suppose nitroglycerin is given, when it is first present to liver, it gets denitrated. See, dinitrate and mononitrate and glycerol. By the time, see, only 10% will reach to site of action because it is metabolism. So to avoid that, what they given is that they are placing the drug under the tongue. It is sublingual route of administration, or sometimes even buccal route. But when you place under sublingual, the action is very, very fast. Within 5 seconds, your pain will be relieved. Even after taking that, if the pain is existing and all that, then bye-bye, what's up? So you need to push. So once you feel pain and you give the tablet, immediately you need to shift the patient to the hospital. Anyhow, in clinical pharmacology, they will discuss all these things. So this is the sublingual route. Why we are giving these different routes? And transdermal patch, here you see applying, because the drug has 90% first pass metabolism. So if you want the same tablet, you can place under the tongue or you can take it. To show action very fast, to elicit the action very fast, you need to place under the tongue. Sublingual route, buccal route, you can place under the like a chocolate, like you can chew. then you can place it as transdermal patch. Transdermal, you can see this is how it is, 8 milligrams. Slowly, drug will be releasing. Sometimes this transdermal patch, TDS, drug delivery system, we call it, it is timely relieved. The release of drug pattern will be timed. So it will release continuously for 8 hours. Then there is a stoppage of drug for another period of some 6 hours. Then again drug will start releasing for another 8 hours. So timely transdermal drug patch, it will release the drug timely. This 6 hours interval where there is nitrate intervals, during that time you can use vasodilators, beta blockers. They also, beta blockers are also vasodilators. Calcium channel blockers also nitrate glycerin. So very good. This is a transdermal patch, nitrate free intervals. And one more important thing we are discussing in advance, nitrates have, what is that? Tolerance. Has tolerance. So you know what do you mean by tolerance? To avoid that also, this 6 hours is called as nitrate free intervals. If nitrates are given continuously over a period of time, vasodilation effect is lost. So this is also advantage, nitrate free intervals. It is called as nitrate free intervals. You can note down all these things. Then how do you synthesize? You are synthesizing by taking glycerol and treating with sulfuric acid and nitric acid. Very dangerous. It's a highly explosive. So you get triglyceride or nitroglycerin. It's a glycerol and nitro. 3 nitro portions are present, nitroglycerin. So this is it. So now, so this drug, you see isosorbate dinitrate, these are long-acting drugs. These are long-acting drugs. Long-acting drug, so it can you can give by oral route. The drug is slowly converted to dinitrate to mononitrate. Mononitrate is also active. The first pass metabolism also is there, but it is long-acting drug. This is isosorbate dinitrite. So because 2 nitrate molecules are present here. So this is an. Then one more drug is amyl nitrite. Amyl nitrite. This is also very, very good drug. Very, very good drug, but it is misused nowadays. It is a yellow volatile flammable liquid. Even nitroglycerin is also liquid and moderately volatile liquid. This is volatile liquid. So the physical property, the more the volatile, the faster the action. The faster the action. So these are the some of the trade names available. You can see it. It is given by mouth. We formulate in such a way that though liquid, you add some what's that? Excipients, it will become liquid or solid. So by mouth, rapidly hydrolyzed. It is anti-anginal drug and it's also used in cyanide poisoning. Nowadays, this drug is used as a drug of abuse. Example, the trade names you can see Propofol, Rush, especially for what is that gay community people, they use this drug to facilitate anal sex. So the trade names you can see Jungle Juice, Rush, or this. These are the medical use is this one, anti-anginal and cyanide poisoning. So these now the adverse effects, the adverse effect of these drugs is very important. So when you dispense, you need to tell that these are the adverse effects. Already patient is in distress, and you should tell that you will be having severe headache. Severe headache. You can see the figure. Then what happens is that your face will become red because of blood flow. Blood flow. That is it is called as facial flushing. Redness you can find it. And you also get hypotension because of vasodilation effect and tachycardia. And never mix these drugs with a sildenafil citrate. That is very, very dangerous. This is also vasodilator, and these drugs are vasodilator. So usually we learned that this disease is for older people, so their sexual performance will be decreased. Then in the market, they will be having advertisement. They try to use this Viagra, but they don't know the symptoms, side effects. So both of them, when you do it, when you administer, the potentiates the actions of nitrates. Sildenafil citrate potentiate the actions of nitrate and causing dangerous effects. So they're very contraindicated. So this is one more important. You should also tell that the patients that the headache over a period of time, the headache will be relieved. So the headache, whatever the side effects we are telling, those also will get tolerated. So headache, first week you'll feel very good, severe headache. After second week, it will decrease like that. So this is it. So here what I'm telling, to avoid this tolerance, you can give nitrate-free intervals. That means don't take. These drugs can show action for 8 hours. After that, you stop. In meanwhile, doctor will prescribe any calcium channel blocker or a beta blocker like that. So this is it. Now, new drugs. So this is called Trimetazidine. Now here, let us see some of the very good drugs. Trimetazidine, this Ranolazine. So here what they do is that there is no oxygen. When there is no oxygen, the heart muscle there is decreased blood supply. That is oxygenated blood. So how does the metabolism occurs here? So body tries to try to get its ATP with the help of fatty acids present in it. So it undergoes, with the help of fatty acid, it goes beta oxidation process to generate ATP. So when you use beta oxidation, to undergo beta oxidation, you need to use the ATP. You need to use the ATP molecules. Already the cardiac muscle is not able to produce ATP. But when there is beta oxidation, you are going to use more ATP molecules. So it is a stress to the cardiac muscle. So these drugs, what it does is that it blocks beta oxidation process. Example, Trimetazidine, which is anti-ischemic drug. Ischemia means, nothing but anti-anginal drug. They block beta oxidation process. How? By blocking this LC3K80. That is nothing but long chain ketoacetyl CoA thiolase. So they block this beta oxidation process and in turn activate pyruvate dehydrogenase. So whatever available glucose is present in the heart, that is utilized and ATP production is increased. So what is the advantage here? These drugs will block beta oxidation process. So when there is beta oxidation process, there is acidity, lactic acid is generated, acetone, acetoacetic acid, what ketone bodies are generated, which is very dangerous. Already patient is in trouble. If these are generated, more dangerous. So this drug nowadays, maybe in what's it? The last 10 years, this trimetazidine, it became a one of the component in angina pectoris. Angina pectoris. So what it does, in nutshell, it is blocking beta oxidation process. It is blocking beta oxidation process and increasing glucose utilization. So the ATP production in this patient is increased. Yes, please.
Sir, I don't know if I understood you well, but I understood how trimetazidine is causing its effect by inhibiting the beta oxidation. But based on the diagram, I am not understanding the correlation between where the trimetazidine is blocking and the effect it will have on the glucose circulation.
Definitely, when you block this beta oxidation, you see in the diagram, you see here, when it is blocking, what happens is that in turn, when there is this blockade, what happened? It is increasing this phosphodiesterase pyruvate dehydrogenase enzyme. It is increasing. If this is going on, no, if beta oxidation is going on, the activity of this will be stopped here. Will be stopped. So you will get your ATP through beta oxidation. Now when there is a stopping here, what happens? This also, the feedback is stopped and this activity is increased, and leading to generation of acetyl-CoA entering to Krebs cycle, and you will get ATP production. This is standard treatment nowadays. Yes, madam?
Yeah, so
Hmm.
I wanted to know exactly like where this trimetazidine, what is it blocking on the beta? It's blocking the beta oxidation, yes, but the
Thiolase.
correlation that's okay, thank you.
That's what here is written, LC3K, or simply you can tell thiolase inhibitors. Thiolase, you can see it, go to biochemistry, metabolism, beta oxidation. The rate limiting step is, the first one is the thiolase. That it blocks it. So there is no beta oxidation and it activates this pyruvate dehydrogenase. Okay, now you can see it here. This drug is having the structure pyrogolol. This is the pyrogolol structure. It is a pyrogolol derivative. 3 hydroxyl group side by side. We learned when there is 2 hydroxyl groups side by side, it is called as catechol. Now one more hydroxyl group it is there, then it is called as pyrogolol, but it is methyl derivative. It is pyrogolol. And it is having piperazine molecule structure. Piperazine molecule structure. Now, this is very good drug, but this drug will produce Parkinsonism symptoms over a period of time. If you use, you get Parkinsonism symptoms like extrapyramidal symptoms, rigidity, bradycardia, and tremors, and restless leg. So continuously, patient will be moving their leg without their notice. If that is there, the patient cannot sleep. So again, you see, Parkinsonism is also old aged patient disease, and this is also old. It will increase, and Parkinsonism symptoms will be present. So that is one of the side effect which is important. Next one, Ranolazine. This also acts in the same way. Ranolazine also acts in the same. It also blocks the thiolase enzyme and blocking what is that, beta oxidation. So shifts the metabolism from beta oxidation to glucose utilization. So that's why these two drugs we classified under what is that, metabolic modulators. I think so we classified as cytoprotective or cardiac metabolic modulators. Standard therapy nowadays, either any one of these drug it is. We also know that when oxygen is decreased, lactic acid is produced. Our body becomes acidic. It's dangerous. So that is it. So these two drugs will act. Some more important thing is that you see, apart from this, Ranolazine. Ranolazine has one additional mechanism is that it also prevent late inward sodium entry. Sodium entry. So after contraction, during contraction and relaxation process, so when it is relaxing, now what happens? Sodium channels will enter, starting again to initiate. So this also block that inward of sodium channel and giving more rest to the heart. So this is in addition to metabolic modulatory, Ranolazine prevents late inward sodium entry. In this way, the dual mechanism of Ranolazine acts on the two hidden causes of chronic angina in angina and provides efficacy in terms of survival rate, angina-free duration periods. Sometimes patient gets pain, relax. So whenever he feels pain, chest pain, it is angina episodes. He can also do exercise ability and nitrate dose reduction. Nitrate dose reduction. You can also see now here the drug is having piperazine structure. Then it is having xylene. Then you can also see it is also having a catechol-like structure. Catechol-like structure. Here we can show it next. Ranolazine. No. This is what late phase entry is happening. You can see it. Myocardial ischemia is associated with increased. We learnt in calcium. What is that? Cardiac glycoside. It blocks ATP. It blocks ATPase. We learnt, no? And when it blocks, what happened? The sodium channels, sodium concentration is increased. We learned that. In the same way here, when there is no ATP, there is no that sodium potassium ATPase pump. So sodium levels are increased. Now what happens? Sodium calcium exchanger will activate it. This exchanger, what it does, calcium is increased and sodium goes out. Here, this is what it stops on, making rest to the heart. So this is the late phase injury, that it will, this is sodium calcium exchange, it will block it. It will block this portion. Then one more drug, Nicorandil. This is also nowadays they are using as associated drugs. So this is a potassium channel activator. Potassium channel activators, what it does is that it causes opening of potassium channels. You see, potassium channel activators combines with ATP modulated potassium channel. That means when there is ATP, this channel will work. So when it binds, what happens? Opening of potassium channel occurs, efflux of potassium occurs. Then the muscle will become hyperpolarized. Positive, no, potassium is positive. It is going positive. When it is going out, what happens? The muscle will be negative. That is hyperpolarization, and it causes vasodilation. Vasodilation effect it produces. It produces. One more important thing is that this is, you see, vasodilating property I explained. Now, among all these potassium channel activators, only the drug in this class is approved for the treatment of angina. Now, it has, you see, nicotinamide portion in it. Nicotinamide, this is a nicotinamide portion, and it is also having nitrate portion. Nitrate, just like nitrates, just like our nitroglycerin tablets, this also causes vasodilation effect by potassium channel, as well as even like a GM, what is that? Like GMP is converting to cyclic GMP, nitrates, nitrites, nitric oxide, same way it can show on. And it is a vitamin molecule. Nicotinamide is a vitamin, and it is easily absorbed. One more advantage is that there is no tolerance with the effect. This is nitrate. Nitroglycerin is having a tolerance, but here there is no tolerance. Comparable efficacy and tolerability to the existing agents and potent cardioprotective action. So this is a Nicorandil. So this is also one more drug which they give on. We are almost finishing. Then these are beta blockers, bisoprolol. How they act is that they decrease heart rate, vasodilation. So this is they decrease the heart rate. That means demand. When there is more heart rate, what happens is that the demand for the is increased. So blood supply has to be increased. So that is decreased. Suppose you are running, or you are climbing a staircase. So your heart will pump more than you are sleeping and all those things. So that is where we can use. Then this is what we were discussing. I think we discussed this. You can see calcium channel blockers. These drugs, you can see this is very good table which is explaining. See, vasodilation effect at coronary. All these drugs action. But you can see the suppression activity at the nodal centers. In the if the nodal centers, if it is blocked, what happens? You see, verapamil is very, very good drug. Suppression of automaticity. Heart has excellent ability. Suppose if SA node doesn't work, then AV node will start initiating work on. it will not, God has created in such a way that one property of heart, one part of heart is not functioning totally, it will not shut down. It will try. It is like us. We try, no? The same way heart will try to survive. That property is known as automaticity. That is less with, see, it is, verapamil is blocking, diltiazem is blocking more here. These drugs, you see, amlodipine, philodipine, diltiazem, nifedipine, see, the coronary vasodilator effect is high. Now, suppression of conduction, you see, amlodipine, nifedipine, 0. That's why I think during hypertension, antihypertensive, we classified the drugs. These dipines are more vasodilators. Then diltiazem will be the medium, and this will be the least vasodilator. But verapamil is very good in arrhythmiasis, I told. If you want, you can see that lecture notes on. So these, that's why calcium channels up to here, they can be used as vasodilators in angina pectoris. We should not give verapamil. Verapamil is having less vasodilation effect. Now, let us see. So this is all. Then last. Apart from these drugs, suppose you given this stunting. You given this stunting. Where is that figure diagram? You place this stunting and all those things. Now, what happens is that there may be chance of platelet aggregation and coming here. See, this is like a net. Yeah, it can come and block here. To avoid that, and fat may deposit. To avoid them, that we use these drugs. Aspirin, compulsory they give. WHO has given guidelines telling that the people who are more than 45, you can take aspirin. So the aspirin dose here is important. You can see it is 160 to 325 milligrams. So if it is acting as analgesics, we take something around 600 mg. 600 milligrams we take. When you reduce the dose almost 1/4 or half, now it is acting as anti-platelet drug. Anti-platelet. Platelet is the one which is responsible. This is one platelet. You consider this is one more. If they combine together, there is a clot. If that clot go on, if it forms on microcapillaries, which we have shown the diagram, what happened? Heart doesn't function. That's why we use aspirin. It can also be combined with one more anti-platelet drug. Very good combination. Many of our parents may be using. Please check their prescription. Clopidogrel plus aspirin. It's also very good combination. It helps in maintaining. Even after cabbage, the coronary artery bypass, they give these drugs. They eat lot of drugs. Then we can also give heparin, which is a anticoagulant, and thrombin inhibitors like uridine, biliverdin. You can also give one. If there is already clot, if you want to dissolve them, then you can use this uridine, biliverdin. No? This all we will discuss in coming class. So this is my lecture notes. You can go through this slide. See, this is one slide which very good slide. See, you will get chest pain. One, and this was discovered. This disease was not a new one. It was discovered during 600 BC. Then first medical description by William Hibbins in something around 1772, but it was discovered in 600 BC itself. Then you can see it, more than 500,000 people are suffering. Then large meal also for this patient. you should not suggest a large meal. It also can risky. Cold weather is also risky. Cold weather is also risky. Then symptoms may also include breathlessness, nausea, abdominal pain. How do you diagnose? By ECG, stress test, angiogram, I told. So they ask you to treadmill in presence of a doctor. If you give stress, you'll feel pain. That is a stress test. Coronary angiography you will do. Angiography is a small surgical procedure where they send the dye and see where are the blocks. So that they give, that's the diagnosis. Then treatment include life changes, medicines, and that is stenting, catheterization. Then death rate in patient with stable angina is almost 7%, you see. So this is about angina pectoris. Let me ask some doubts or any doubts is there? Any clarification required, please? Okay, let me ask some questions. Kaleb, please do sign. Only 39 people have signed. 50 people are present. Mr. Kaleb?
Yes.
Give some, what is that? Drugs which prevent, what is that? Fatty acid metabolism. Hey, Kaleb, you didn't listen. Anyone, please? Kaleb, are you there? Yeah, Priska, tell me.
I think it's Trimetazidine.
Okay. What about Ranolazine? Is the same person. Rutendo?
Yes, sir.
Rutendo, can you please? Please go.
That one, the second one you said, it also acts in the same way, but it also has an additive function in that it prevents the late invasion of sodium. Yeah, and it shifts the beta metabolism to glucose metabolism.
Okay, very good. 1 second, please. My charging is going. Now, anyone can speak about nitrate-free intervals? Let me ask some. Denise. So are you absent?
So have you said Dennis or Denise?
Okay, you tell Denise Muchai.
You said about nitrate
No,
drugs.
nitrate-free interval. What do you mean by nitrate-free interval and why it is necessary?
I'm not sure, but I think that's when it's the transdermal patches and they release nitrate continuously, causing continuous vasodilation. And I think it's important in unstable angina because the unstable angina is unpredictable.
Then you need to give, if it is unpredictable, you need to give continuously, but we are stopping. So please listen again. Nitrate-free intervals is very important because these drugs produce tolerance. They produce tolerance. Not only for the activity, it also produces tolerance. Tolerance is also for the side effects. So we need to give nitrate-free drugs. Even of the tablet, you have taken long-acting drugs. For example, you have taken these long-acting drugs. These solids, these are long-acting drugs, which are in the solids. You see, isosorbate dinitrate, mononitrate, erythritol tetranitrate, pentaerythritol tetranitrate. These are long-acting drugs. So they are given in the form of oral route. Now here, if you take continuously, so for example, 2 tablets per day, it's dangerous because vasodilation effect is tolerated. To avoid that, what they give is that 1 dose per day. That means half of the day it will work. Remaining half of the day, you can manage with these drugs like beta blockers, calcium channel blockers, or AC inhibitors. You can manage it. Tolerance is present even with the activity, even with the headache. That's what I was telling. I showed you that the side effect of nitroglycerin is headache. By the 2nd week or 3rd week, patient will be stabilized. The headache will be decreased. Okay, then. Bye-bye. If you have any doubt, you can ask. Otherwise, we can leave.
Sir,
Yes.
will you kindly post these notes on Blackboard?
It is there already.
I couldn't see it.
No, it is there, you see. Yesterday also I checked. In 9th week or something, it is there.
Okay, thank you.
Otherwise, I also will check. No problem. Immediately I will do.
All right.
Yes, Isaac.
I have a question.
Please.
You said the nitrates have a 90% fast pass metabolism. So is there an IV formulation for them, or why you have not talked about it?
No,
IV?
there is no IV formulation.
Yes.
Only tablet form. A transdermal. Like that. There
Is
is
it
no
possible
IV.
to have one?
Yes, please. Yes, please. Sorry.
Why don't we is there any research going on about IV formulation? Because I think if 90% first pass, then that means only 10% is getting
very dangerous. Vasodilation may go collapse. That's why sublingual. See, when you are shock, you are in the road. Can you give? God has given very good route. You can't put IV route. You can just place under the tablet. The patient will be, usually they tell to carry a bottle with them. So when they feel any stress, very painful, they know this. What they do, they take the tablet and place under the tongue. Within 5 seconds, the pain will be relieved. He will sit. Then he should go to hospital. The doctor will tell them to hold them like a mobile. Mobile, wherever you go, you carry nowadays. No, the same way they should carry.
Get it. Thank you.
Yeah.
So I have a question.
Please.
Will you be available in your office today?
Yeah, come now.
Or not now, like later in the day?
What time you tell?
Around 4.
Why